Good afternoon, everybody. Thank you very much for joining us in the first of what we hope will be a series of Healthy Hour live sessions as we work through the pandemic. My name's Tom Moore. I'm the CEO here at MedicAlert, and I'll be hosting our session today. If these sessions are popular, we plan to continue them, and we've got a whole range of topics we'd like to bring to you. We've received a number of questions. These are concerning times. We really are here to help our members, and we've got a lot of expertise and experience in helping, particularly through emergency situations. We're very grateful today to have with us Professor Gerry Fitzgerald. Gerry is a director of the MedicAlert Foundation and has a lot of experience. He's worked as an emergency physician. He has spent many years teaching at Queensland University of Technology, particularly in disaster and pandemic management. Now, Gerry is trying to retire, but he's very, very happy to be out of retirement, helping people through these difficult times. So what we'll do, the format of the session is that we'll work through we can't get through all the questions, so we're working through all the questions, what we think is a representative section of what you're asking. And Gerry will be answering this as we go through, and then we'll wrap up at the end. Okay, so Gerry, what we'll start with, I'll introduce you and ask you to, I'm very sorry, we just didn't have the presentation where it should be. You see that now, Gerry?
Yes, Tom, yep.
Okay, all right.
Well, thanks, Tom, and hello, everyone. I thought I'd just open this session by giving you a little bit of an update of where we are with respect to this disease and the current status of the pandemic in Australia and the risk to people in Australia, and perhaps a little bit of what we think is likely to happen next. So you're probably aware of much of this, but let me just restate it just so that we all understand. This is a serious illness. It's highly infectious. It spreads relatively easily. The people who are at most risk are people who are older, who have hypertension, diabetes, cardiovascular or respiratory disease, or any immunosuppressive illness. And so in many respects, that means a lot of the people who are members of MedicAlert are in the at-risk category. What we know about this disease is that of all of the people who will get the disease, about 80% will just get a mild illness. It will be probably indistinguishable from a common cold or a sore throat. About 20% will get a severe illness, and roughly 5% of people will get a very severe or critical illness and require intensive care management. And we know at the moment that somewhere between 1% to 3% of those people who are diagnosed with this disease have died. So it is a serious illness, but on the other side of it, of course, is that the vast overwhelming majority of people will recover. The sad news for us of a certain age is that the rates of severity increase with age, and they increase with the other diseases and illnesses that people have, particularly older people. The disease presents in much the same way as we would expect a cold or flu. It presents with a sore throat, with fever, with coughing, and for those people who get severely ill, then it goes on to cause shortness of breath. The disease essentially attacks the lungs, first of all, commonly, and causes a primary pneumonia. And what they found around the world with this is even people who seem to have no symptoms, when they take an X-ray of their chest, they see they actually have patchy pneumonia, which is typical of viral type illness. And we don't know what happens afterwards, of course. This disease has only been around for 4 months. It seems like it's been forever, but it's actually only about 4 months. And so we don't know what the long-term consequences are for people who've had this disease. For those who get very, very severely ill, and do recover, it is likely that they will have ongoing lung problems. So where are we up to in Australia? Well, we've been actually very fortunate in many respects, but in other respects, we've made our own fortune. We have managed this disease very well in Australia in comparison with other countries, in that we now have a little less than 10,000 cases. I think the number of new cases yesterday was 8 across the whole country. So the thing that worries us most about these diseases is whether there is sustained and persistent transmission in the community. And we have to say now that there is no evidence that there is, which is good news. By comparison in other countries, and perhaps the worst example around the world now is New York City. New York City has about 8 million people. They estimate probably 1 in 5 people have had this disease, and 16,000 people have died as a result. Now, if we have 3 times the population of New York City, so if we had that sort of death rate in Australia, then we'd be talking of around about 40,000 to 50,000 people would have died across the country, and in fact, less than 100 have. So the pain that the country has gone through to achieve this has certainly had benefit in terms of reducing the impact that this disease has had on Australia to date. But the disease remains a risk. And so the pathway out is, because we have stopped community transmission, that as a country, it is now reasonable to start and very carefully open things up again. Because it's important that we get the economy moving, it's important that we get society moving. People have other things that they need to do. We've got people who are reluctant to attend to healthcare for other causes because of the potential of COVID-19. So we need to get people back into doing things, and particularly getting their routine medical care sorted, etc. That will be done gradually and will be done safely. Each time, all the time, testing to make sure that there's no rebound outbreak in Australia. I think our international holidays are on hold, I suspect, for at least 18 months to 2 years. But that doesn't mean that before then we can't get to having domestic holidays, and included in that would be an umbrella which would probably include New Zealand, because New Zealand has had equal success in terms of stopping the transmission of the disease. So, Tom and folks, I think that's where we are in terms of the disease to date. I suppose in summary, it's good news for Australia, but it requires us for the next 12 to 18 months to continue to be very, very careful and to be alert and watching all the time for any potential outbreak of the disease.
Okay, thanks, Gerry, for that intro. We do seem to be in a fortunate position. Still work to be done. Let's get to the first of our member questions. Vicky from New South Wales asks, as an asthmatic, will my daily peak flow chart help in diagnosing this virus?
Yeah, thanks, Vicky. The answer is no, really. If you were to catch this virus, and given all that I've just said, the chances of you doing so at the moment is very small. But if you were, then you're going to get the same symptoms as other people, which is sore throat, etc. The medical thing is that you would have to be quite sick before your daily peak flow changes. And so it's not an early sign by any means. In fact, it would be a later sign of the disease for changes in your peak flow. So the best thing to look out for is those other symptoms, the sore throat, the fever, the cough, the shortness of breath, those sorts of things.
Okay, thanks, Gerry. Franco from Victoria, 65 with high blood pressure and a number of other conditions. Would like to know if there's anything extra that he should be doing apart from the recommendation by the government. Would like to go back to work in an office environment. Is that wise?
Yes, thanks, Franco. Look, obviously, you fall into the category of people who are at risk. But as I mentioned before, the virus has to be present, and at the moment, it seems to be controlled in this country and is not present. So that's good news. There's nothing further that you need to do. Well, let me change that slightly. I think the best advice we would say to everybody is follow the government's recommendations. That's very important. Firstly, because there are actually penalties if we don't, but also it's important that everybody does the same thing, and the best way of achieving that is for us to comply with what the government is asking us to do. And look, the main simple things about that are just the things that everybody is advised to do, which is enhance personal hygiene, be careful about coughing and sneezing, stay away from people wherever you can, either completely socially isolated at home, or if you do need to go out, then just be cautious, be careful. So enhance personal hygiene and social isolation are the key messages. If you do go back to work, it depends a little bit in terms of in an office environment as to whether you can actually structure the office environment. Just again, extra precautions. This is all just extra precautions to have some degree of social isolation. That is, we talk about 2 arms length distance from other people, and all that's about is if against all the odds, somebody else in the office had the disease and they coughed, then the virus particles or the cough particles will settle within a metre or 2. And so it reduces the risk. And then also just hand hygiene, washing your hands. If you can get hold of some of that hand sanitizer. I'd see it's starting to come back into the shelves now after the initial panic buying. Then I'd try and get hold of some of that and just use it regularly and be careful about touching your face, touching your eyes, those sorts of things.
Okay, thanks, Gerry. Natasha, WA. So as these social distancing restrictions are relaxed, and for someone with under immune suppression, what are some of the best ways to keep protected once family members have gone back to schools, universities, and start mixing in the public again?
So Natasha, again, there's you and there's your family members, isn't there? You with immune suppression, of course, are at increased risk, actually not only from COVID-19, of course, but from other things. And we have to remember that there's probably more flu happening around than there is COVID-19 in this country. And of course, there's more common things like common colds and things like that. So you do need to take extra precaution. It's not that the risk is high. The chances of you or any members of your family having this disease at this point in time is very low. It's quite different if we were in Italy or UK. The story would be quite different. But in Australia, the risk is very low. And so the government advice is to start getting people back to school and universities and public transport is based on the presumption that there is no sustained community transmission happening of the disease, in which case the risks are no greater than they would be at other times. But just as an extra precaution, we're suggesting to people, just play it safe. Keep a distance if you can, but I think once the government's saying people can start moving around, then they're starting to say that they can start interacting, particularly with family members, because we're seeing this, aren't we, in a number of areas, particularly in nursing homes, and where elderly people who are at risk are becoming very socially isolated. And that's probably causing as much distress as the potential risk from this disease. So take extra precautions yourself, but if the family is starting to move around, then it's probably back to normal in terms of your interaction with them.
Okay, thanks, Gerry. Carmen from New South Wales. So a person with MS or other chronic illness, what can they do apart from the hand washing, social distancing, eating well, to keep their surroundings clean and prevent the onset of COVID-19?
So the key community strategies we've said are enhanced personal hygiene and social distancing. So personal hygiene is washing your hands, washing down surfaces, etc., just in case the virus has been shown on certain circumstances, on certain surfaces, that it can stay around for a number of days. So just cleaning, particularly bench tops, handrails, things that you touch very frequently, in addition to regular hand washing. The social distancing, again, is depending on your circumstances, but look, they're the main things that we continue to recommend, and it's no different to what is being recommended for the community more generally. It's just that, of course, with multiple sclerosis and other chronic illnesses, then people are at risk, and we're just saying, just take that little extra precaution where you can, keep a little distance until we're absolutely sure that this is eliminated from Australia.
Okay, thanks, Gerry. And Cheryl from Queensland asking about people with chronic cardiorespiratory issues. Would they need to wear a mask if they're not at home?
So Cheryl, this opens up two things. One is that, of course, with cardiorespiratory issues, then of course you're at increased risk than the general public or the younger people. But it opens up the other question of wearing of masks. This has been a bit of a difficult question, because there are other countries, particularly countries where there has been a widespread outbreak, where there has been a strong recommendation to wear masks outside, particularly the Asian countries, where there's a little culture, I think, of people being prepared to wear masks, etc. The science says that the type of mask that you can generally buy at a chemist shop will not prevent the virus getting through them. The weave is too open and the virus particle too small. It'll just go straight through. And so we don't generally recommend that people wear a mask to protect themselves. However, if you wish to, then there's no harm in it. The only thing we would say, the two things we would say is that we're concerned that the masks need to be available for those who really need them, and that is particularly the healthcare workers and the people who are in other difficult situations, and for those people who may actually be sick, because those masks can be useful to stop the spread from somebody who is sick. But if you're not sick, then the two things, as I say, we say is don't take them from people who need them, and secondly, don't rely on it, because the mask will not prevent the infection. So you need to do the other things, the social distancing, the hand hygiene, and the environmental cleansing.
Yeah, thanks for clearing that up, Gerard. It is a confusing issue, isn't it? We hear from different jurisdictions.
Yes, yeah. And I think part of that, the messaging around masks has been a little bit confusing, because the science is clear, and we probably have said, no, you shouldn't wear. We've stepped from don't need to wear a mask to you shouldn't wear a mask. Whereas in fact, if you want to wear a mask, it's not going to do you any harm. We just want to make sure that people know that it's not going to be protective, and so you need to do the other things.
Janet from New South Wales would like to know about going for bushwalks with a partner, and is it okay to sit on a rock and eat a lunch if we're sitting 2 meters apart?
Well, you might need a cushion or something, because it might be a bit hard otherwise. Janet, what you've raised is what we call the isolation bubble in many respects, is that obviously if this is a residential partner, then you and your partner are actually in the same bubble. And so it is you together that need to isolate from others. But of course, there's no point trying to isolate from each other unless one of you gets the illness, in which case then that's all bets are off and you have to try and separate then. But clearly exercise is good, and people should be out and about trying to get some exercise wherever possible. And of course, sitting, with you and your partner, if you're within that same bubble, as we say, then you're not at risk to each other. The only proviso I would say is be careful and make sure that whatever you're doing is consistent with what your particular state government requires. That's so that there is consistency of behaviour, and of course to keep you out of trouble with your state governments as well.
Do the right thing. Yeah. Just before we move to the next questions, I will say that we do seem to be getting a few comments or questions in, which is great. If the technology and time allows us, at the end of this session, we will get to those questions. So
that'd be terrific. Thanks.
So find them in if you can, and again, bear in mind this is our first time through, so we're just testing the technology as well as the format. Okay, if we move on, Robert from WA, are there any guidelines for people with multiple illnesses, or is it just a guessing game for us?
Well, the guidelines are the same as for anybody with multiple illnesses or anybody who is at risk. So people with multiple illnesses are certainly at increased risk and from the disease, but the protections are the same as for other people who are vulnerable, such as elderly people or people with immunosuppression, and that is enhanced personal hygiene, personal social isolation, and compliance with any other government requirements. I'd throw in another thing here, Robert, too, and that is make sure your other illnesses are being looked after, because there's a little bit of a worry for me as an old doc, and that is that people are probably neglecting the things that are equally at risk to them. You know, I mean, if we say, oh, well, I won't go and get my diabetes checked because of COVID-19, then people are going to be at just as much risk from their diabetes as they are from COVID-19. So it is important to keep an eye on all the other problems and make sure. But there's no extra magic in this. It's still the standard protections that everybody has to take, and it's just about reducing risk. You know, if we all do this, then and we reduce the likelihood that we're going to have contact with other people, then we will reduce the likelihood that we can catch the disease from them. And that's what all of these strategies are about, and that the personal hygiene is about that not only am I staying a distance, but if somebody has coughed or sneezed or whatever, and that virus particle is sitting on a bench top and I touch it, then I'm going to wash my hands, then washing my hands, not touching my face, all those sorts of things can help the transmission of that disease to you. None of this is guaranteed. You know, even where we've seen the widespread outbreaks, you can do all these things and just get unlucky. But at least it does try and reduce the likelihood, and that's the best that we can offer.
Thanks, Gerry. Slight typo there. And so any advice for teenagers with type 1 diabetes, and what did the statistics show with this cohort in terms of susceptibility, severity, and recuperation from COVID-19? Beverly from Queensland asks. Yeah,
Beverly, there's two elements to this. One is because the teenager has diabetes, then they are at slightly heightened risk because of the diabetes. But if the diabetes is under control, etc., then that risk is unlikely to be excessive. But because they're a teenager, then they're at much lower risk from this disease. So I'm not sure that we've got to the stage now with the disease that's only a few months old, of being able to work out particular subcohorts, the risk of particular subcohorts, such as teenagers with diabetes. But we do know that teenagers generally have a very low risk. You know, for example, around the world, there's probably only been 2 or 3 children under the age of 10 who've died of this disease out of over 200,000 people who've died. So it is a very unusual disease in that it does not seem to be affecting children at anywhere near the same rate as, for example, influenza would, or as this disease is affecting older people. And we're not yet able to explain that, But it's certainly observed in every country that the rate amongst younger people, about teenagers and children, is much lower, and they get a much less severe illness, and such that really very few children or teenagers have died as a result of this illness. So that's good news for younger people, but certainly there is still a technical risk.
Carol, in WA, I have COPD and immune suppressed. So is staying at home the best defense against COVID-19?
Yes, I mean, it's probably if I can put an explanation around social isolation, when the technical thing we describe in pandemics, we talk about it, the reproduction factor, which is how many people a person with the disease passes that disease on to. And to some extent, that's because that's determined by how infective the disease is. So things like measles, for example, is incredibly infectious. But so is common colds and flu. We know, when the little kids come home from the childcare with their diseases, they manage to spread it around kindly amongst all of their parents and grandparents in record fashion. So some diseases are highly infectious, whereas other things like, for example, tuberculosis is very hard to catch. So it's just not highly infectious. But it also depends on how many people you have contact with. So if I, for example, caught COVID-19 and then went off to my job as a lonely lighthouse keeper, then I'm not going to pass it on to anybody because I'm not going to see anybody. If, on the other hand, I'm the ticket collector at Shanghai railway station, then I'm going to be passed by about 1 million people every day. So you see, it's contextual. So the simple logic is, if we can separate the people who might catch this disease from the people who have it, then we will reduce the likelihood of it spreading. So that's the simple logic around social distancing or staying at home, staying away from other people, etc., and supplement that with personal hygiene things such as keeping places clean and washing your hands, etc., when you've touched anything.
Thanks, Gerry. Now, this question is an interesting one. It from Gerard in New South Wales. It covers the conditions that many of our members experience. So is there anything special then, Gerry, about people with hypertension, asthma, epilepsy, type 2 diabetes, AF, they should be doing to take care of themselves at this time?
No, Tom, and Gerard, it's the same protections as everybody else with who are at risk. We don't know at the moment if there is particular risks associated with people who are hypertensive and epileptic versus hypertensive and diabetic, and all of those sort of subunit analysis will probably be done in the papers over the next year or two, where people analyse the relative contribution of each of those things. But in general, people with any of those at-risk conditions are known to be at risk of more severe illness, and therefore should take extra precautions, but those precautions are essentially the same precautions as we're suggesting for everybody, just being more careful about it, and that is social distancing, personal hygiene.
Thanks, Gerry. Small rural hospitals. So in fact, Beverly in Queensland asking about how do you get treatment if in those smaller areas, perhaps more resource challenged, are dealing with COVID-19?
Yeah, thanks, Beverly. Look, this probably raises the same issue about the interaction with the health system. When we teach about this, I often describe the people from the disaster become VIPs. Everybody wants to concentrate on the people with the disasters, and what we tend to do is then there's a tendency to forget about the other people, the people who haven't got COVID-19 or haven't been from the disaster, but who are having serious medical complaints for a whole range of other reasons. And so it is behoven on our health services to make sure that they don't fall into that trap. and that they continue to look after the other health needs of their community. At this point in time, Beverly, if you roll up to a rural hospital, there is almost no chance whatsoever there'll be anybody there with COVID-19. If you look across this country, there are only a relatively small number of people in hospital. When this outbreak first occurred, we started thinking about if we get to Italy's stage or the UK or USA, then how are we going to have enough health resources? And so there was a lot of concentration on intensive care wards and the need for ventilators and how we surge the capacity of our health system. In reality, our health system is relatively quiet because people are home and not doing the things that normally get them into trouble, such as having accidents and injuries and other things. And as a result, we actually, as I say, the health system is relatively quiet. Now, I can't speak for any particular hospital, of course. And if there are issues associated with a particular hospital, then that's for the health system to respond to. But what I would say to you is that you should be able to get treatment at any health facility, including primary care, your general practitioner, etc., because at the moment they will not be dealing with COVID-19.
Sure. It is interesting, isn't it, that in terms of the data around where COVID is occurring, I'm not sure we can isolate it to different places, can we? Is the data collected on a regional basis, do you know, Gerry?
Well, the cases are, so we know where those cases are. For example, I think Beverly in Queensland, west of the Great Divide, there's been no cases. So, you know, one could run an argument that it should be business as normal out there because of that, and maybe that will happen. But of course, it's hard to define where the divide is and all those sorts of things, and therefore becomes mixed messages if we start segmenting it like that. But there has been the overwhelming majority of cases in Australia, 70%, are from returning travellers. The remainder are from people who've had contact with returning passengers, or there has been a small number of significant clusters where there's been person-to-person spread. There's one in Tasmania with the northeastern hospitals there. There's certainly one in a nursing home in New South Wales. There's been a couple of other, I think Adelaide Airport had a little cluster, and we've had some clusters on the Sunshine Coast and Gold Coast in Queensland. So, but generally the authorities know where they are and they're controlling them. But most people got it overseas. Okay,
thanks, Gerry. So that's the end of the formal set of questions we've selected as a representative selection from those asked. What I'm going to try and do now is I'm just going to try and have a look if my controls will let me see. Now, it's not going to work very easily, so here we go. I'll just have a look because some people have put in questions, Gerry, so here we go. Let me just have a look here. There are more comments than questions. Here's one from Asha. What's your view, Gerry, about schools reopening?
Thanks, Asha. That's a good, intense question. Look, and it's been a debate all the way along the line. Ordinarily, with outbreaks of infectious disease, and particularly respiratory infectious diseases, the schools will be closed very quickly. And the reason for that is the little kids, God love them, are the super spreaders of those diseases. They don't understand personal hygiene and they don't understand social distancing. And so they spread the illnesses very quickly. But we know that there's consequences of closing schools. We know, for example, that when we have these situations and schools close, we lose a whole heap of our nurses and doctors from the hospital because suddenly their working arrangements are predicated on the kids being at school. And if the kids aren't at school, then somebody needs to stay home and look after them. And so that's a real issue. That secondly, of course, that there's always been a concern that what do the kids do, particularly the older kids, as they end up going to shopping malls and things like that and hanging out together. And that's a more dangerous and more uncontrolled environment than the actual formality of school. And then of course with this particular one is different, and it's different in twofold. One is it's different because we can't see a way out of this disease going away quickly. This is not like influenza, where a new strain of influenza, all we have to do is tweak the previous vaccine and roll it out, and we can get control of this. This is a new disease, and we don't have vaccines to coronavirus yet. So it's going to be a longer time, particularly overseas. And if it broke out in Australia, we'd follow the same thing. There's no reason why it wouldn't break out in Australia. And then the second part of this is the unusual picture of kids not getting it. And that's been reinforced around the world. And there's been no outbreaks in schools, which is very unusual for a respiratory disease. And so on balance, the public health advice has been pretty consistent about this. And that is that the risks of keeping schools open was outweighed by the potential benefits. Now, as a result, at this stage, we're probably, and that was in the stage where we didn't know what was happening. You know, the numbers were going up very quickly. We looked like we might be going to get a substantial community outbreak. We didn't know whether we were going to be able to get it under control. But now I think we've got a clearer picture. As I said earlier on, I think there's only been 8 new cases in Australia, in the whole of Australia. You know, by comparison, there were 32,000 new cases in the United States yesterday. So we have got to the stage where we've got this under better control. And we feel that I think the health authorities are now getting to the stage of saying, if we can demonstrate that, and you can't rush it, we've got to make sure there's a 5-day incubation period. We've got to make sure that that's consistent and doesn't spike up again. But if it doesn't, then it's probably worth getting kids back to school, because if we can get kids back to school, we can get the economy restarted, we can get people back to work, we can get the economy restarted. We don't lose, you know, a whole year of schooling for kids, etc. And the risk is negligible. But all of that's predicated on us continuing to carefully watch and test everybody, test widely. You know, a bit of side thing on that is that in New York, in the United States, they're finding a positive case for every 5 tests they do. In Australia, we're finding a positive case for every 500 tests we do. So that's the difference. In Australia, it's under control. There's no evidence of sustained community transmission. Nevertheless, we're proceeding cautiously. Very long-winded, Asher, way of saying, I think we should start getting the schools going back, but probably in a week or 2, for sure, you know, when we're absolutely sure that we're not going to see a sudden spike up again.
Yes, those numbers, very stark contrast there with what's happening overseas, Joe. And Tom asked about being diabetic and with COPD. I think we probably covered that in a previous answer, Gerry.
Yeah, Tom, it's all the same. It's essentially we have to presume that anybody at risk needs to be extra cautious. Now, as I say, the risk of, Tom, you getting a COVID-19 at the moment, I'm not sure where you live, but you know, let's say you don't live near one of those clusters that's been happening, the risk of you getting it is negligible. And however, if you take extra precautions like hand washing and personal hygiene and social distancing, then it's less than negligible, whatever that is. Nobody's going to be able to guarantee you that it's 0, because that's life. It's complicated. But what we would say that it's very low risk, and you're probably at risk of not having your chronic obstructive airways disease managed better and things like that if you lock down too much. So certainly make sure you continue to get your health care for your other conditions. Keep away from people unless you absolutely need to. And so that's the social distancing and just personal hygiene.
Steph is asking, is quite worried with the current drop in temperature and the cold air itself, the trees, bat droppings, and it's forcing her to use her inhaler from twice a day to 3 or 4 times a day, and also using nebulizer a couple of times at the weekend. Still walks to the shops, trying to be careful, wears a mask. But as a severe asthmatic, she's worried about the cold air, and finds she coughs a lot for the slightest reason. So it sounds like Steph is finding it a little trickier now, and perhaps wondering if there's any advice you could offer there, Gerry.
Well, certainly, Steph. I mean, firstly, with respect to the COVID-19, is that like any respiratory virus, they stay around longer in cold temperatures. So the warmer the temperature, the more destructive it is on the virus, and they don't stay around long on surfaces and things like that. So that's why we have outbreaks of cold and flu in winter, because the viruses are around more frequently. So again, caution and care. But look, I think what you're describing there has got nothing to do with COVID-19. That's about your asthma and your chronic obstructive airways disease. And my best advice to you is you need to go and check up with your doctor, just to make sure that it's under control. As you're probably aware, I mean, cold air can aggravate things generally. Plus, of course, you know what's happening in terms of the pollens in the air and things like that. But if you're really struggling a bit there, then I think you probably need to revisit that with your general practitioner or physician.
Cheryl makes a comment. She's finding it very informative and interesting, Gerry, this session, and helped her to understand the situation better and the need to stay well and stay in touch with my doctor. I think we're all experiencing that from the information you're sharing today, Gerry.
Good, thank you.
Final comment coming through on the chat line, Rosalind. And doctors say that if you've an underlying heart condition, you're more likely to have serious effects. So is having a pacemaker for AV failure, but no other heart disease, in that category of the underlying heart condition that could have serious effects?
Look, again, it's probably too early for us to know the specifics of whether a pacemaker or being older or a cardiac disease or whatever. So at the moment, we know that for those people who have got severely ill in other countries, and a lot of this comes out of detailed analysis from China, but increasing analysis from Italy and other places where the outbreak is proceeding. And just to put that in perspective, I mean, we're only talking about 6 to 8 weeks when those countries have had theirs. So the longer term experiences from China is that people who got sicker tended to be people who were older, who had hypertension, cardiorespiratory illness, or any immunosuppression, and so and diabetes. And so we know that, but what we don't know is whether there's any specifics. I suppose the point about it is you don't need to do anything differently. You just need to consider that you are in an at-risk category, and at the moment it's just wise to take extra precaution. If, God forbid, we do get to the stage where there's a major outbreak, then you're going to have to be really very careful. But I don't think we have the specifics of saying you're at risk or not at risk, depending on the particular nature of your cardiac condition.
Louise makes an observation that asking about people's mental health. We haven't covered that today, Gerry. Any comments around that?
Look, very good point, Louise. Thank you for raising it. We always talk, when we talk about disasters, we often talk about the direct and the indirect effects of the disaster. So if there's a flood, obviously a dreadful direct effect is people can drown in the floodwaters. But the indirect effects are much more significant. And that's why in poor countries, for example, a long-term effect may be very serious poor health, because they lose their job and they can't actually afford to go for healthcare, etc., etc. So there are those longer term indirect effects from disasters. Now, and we know that that has a relationship with economy, which is why there's a little bit of, medical enthusiasm for getting the economy moving again, because we know that the greatest risk factor for poor health is poverty. So we want to try and get people moving again and try and get the economy picked up so that we can ensure that people's health and well-being is looked after into the future. But the one you've raised is very important. And I think it's important in two ways. One is, of course, for those people who've had a very serious threat to life because they've had COVID-19. And some of these will have seen their friends get very sick, and some will have seen friends die, and families will have had people who've died as a result. But on top of that is the issues associated with losing jobs and all of that sort of stuff has a very significant impact on mental health. And so it is really important that our system, and a lot of the states have already been quick to this. And I think a lot of money has gone to try and support some of the services that people rely on and depend on. But we do need to keep that very clearly in mind, that the mental health consequences of this will go on for many years.
A comment from Lena. It does appear Lena's joined us at 12:30 South Australia time, so we may have got the time zones a little bit out of sync. I'm not sure. We'll double check that. Apologies if we have, but the full recording will be available, and we make sure you know how to get to that. So Lena, you have missed some, but we'll make sure you get to see a recording. Margaret asks about hypertension. If it's well controlled, should we be worried? And also, there seems to be a question around those taking ACE inhibitors. Should we be worried about that?
That's a good one, Margaret. Good question. I think we're all, including me, in the same boat, and so those issues. The evidence, the only evidence that we've got at the moment is that hypertension is a risk factor for severe illness, which is very unusual. It's not something that we would ordinarily be concerned about in terms of a respiratory infection. And so that question has been raised: is it something related to the medications that people are on? And I've got to say that at the moment the jury is out. There is not sufficient data yet, sufficient evidence to say that it is a result of ACE inhibitors particularly. There is some alert. There was papers that raised this as a potential risk, but the American Cardiac Society and the other cardiac societies have said that there is insufficient evidence to suggest or to recommend to people reconsidering their medication at this stage, particularly if they require that type of medication for other reasons. That is, that people have cardiac disease, etc. So my best advice there is to, again, I think, have a chat with your doctor about this, because at this point in time, with no domestic transmission going on in Australia, then we probably don't need to worry. And it depends on what's right for you and the management for your hypertension. But it seems to be an issue. It's an issue that's unresolved, and it doesn't seem, I haven't seen anything at the moment which says it's related to that the risk changes with the degree of control. So it seems to be just the presence of hypertension, treated or untreated, that seems to be a risk factor.
Okay, thanks, Gerry. Look, thank you, everybody. We'll call a halt to the questions there. We've answered all those that have come in, but in conscious of time, so we need to wrap up. So, Gerry, thanks again for your insights. Are there any other concluding comments or summarizations you'd like to share with us before we finish?
Look, probably just a quick sum up. I think this is a serious illness, but I have to say it's not Armageddon. It's not Ebola, which is a much more dangerous illness and things like that. If the worst comes to the worst, then unfortunately a lot of people are going to get really sick with this illness. But civilization will continue. So we need to take this very seriously, but it is unwise to panic. And I suppose one of the great disappointments for me is the degree of panic in our community about, toilet paper to pasta to, I haven't quite understood that yet. Our members are at risk, and you need to be, therefore, taking reasonable extra precautions. At this point, you don't need to worry too much. There is not significant presence of the disease in this country. But it is nevertheless wise to be careful and cautious and do reasonable things, and particularly to look after yourselves. And particularly look after your other medical complaints, because I think that's the really important thing. You don't want to, we survive the COVID-19 only to, find your chronic asthma gets worse, or your heart, you require further cardiac procedures or something because you've let your heart problems get out of control. So make sure everybody does look after yourself. Stay safe. Take care of yourselves, eh?
All right, thank you, Gerry. That's been really informative, and thank you everybody for participating. We are learning. There were one or two gremlins along the way, but thanks for sticking with us. We exist for no other reason than to protect Australians. That's why we're here, and we're going to continue to give you updates. Stay in touch. Use Instagram, Facebook, website, whatever it is you prefer, and we'll keep getting the information out. A recording of this webinar will be published, so you'll all be able to have another look back through that. So I can only echo Gerry's comments. Stay well. Keep listening to the public health advice, very important. But of course, we are doing very well in Australia, but it's no time to be complacent. So with that, I'll sign off. This is Tom and Gerry saying thanks. And stay well, everybody. Bye.
Bye-bye.